Welcome to this video on the foundations of epidemiology based on Chapter 1 of the textbook Introduction to Epidemiology by Ray M. Merrill. In this video, we'll explore what epidemiology is, how it helps us understand and prevent disease, key models like the epidemiologic triangle and chain of infection, different levels of disease prevention, and why this field is considered the backbone of public health. Let's get started. What is epidemiology? Epidemiology is the study of the distribution and determinants of health-related states or events in human populations and the application of that study to control health problems. In simpler terms, it's about understanding who gets sick, why they get sick, where and when illness occurs, and how we can prevent or control it. Unlike clinicians who treat individual patients, epidemiologists focus on populations. They investigate trends, exposures, and patterns to guide public health actions. Descriptive versus analytic epidemiology. There are two main types of epidemiology. First is descriptive epidemiology, which focuses on who and when. For example, 50 cases of food poisoning occurred in a college dorm in Houston in October. Second is analytic epidemiology, or focuses on why and how. It tests hypotheses, often through studies comparing exposed versus unexposed groups. Together, these approaches provide a full picture of a health issue, case concepts, and epidemic types. Let's break down some key concepts. Case: a person diagnosed with a disease or condition. Case definition: a standardized set of criteria used to ensure consistency across diagnoses. Index case: the first documented case in an outbreak. Primary case: the actual first person to get sick. Secondary case: someone who gets infected from the primary case. We also classify outbreaks as epidemic, more cases than expected in an area. Pandemic, global spread, think COVID-19. Endemic, constant presence of a disease in a region like malaria in parts of Africa. Outbreak, localized epidemic. The epidemiologic triangle and disease transmission. A foundational model in infectious disease epidemiology is the epidemiologic triangle, made up of agent, the cause like a virus or bacteria. Host, the person who gets sick. Environment, conditions that allow transition. Time is sometimes included as a fourth dimension. Another key model is the chain of infection. First is pathogen infectious agent. Second is reservoir where it lives. Third is portal of exit. Fourth is mode of transmission, direct or indirect. Fifth is portal of entry. Sixth is susceptible host. Stopping an outbreak involves breaking the chain. Levels of prevention. Public health uses three main levels of disease prevention. First is primary prevention, preventing disease before it happens, for example, vaccines, health education. Second is secondary prevention, early detection and treatment, for example, screening for high blood pressure. Third is tertiary prevention, reducing the impact of an existing condition, for example, rehab after stroke. These levels form a framework for interventions and policy. The role of epidemiology in public health. Epidemiology supports nearly every function in public health: identifying causes of disease, tracking outbreaks, evaluating interventions, informing health policy. For example, in the famous cholera outbreak of 1854, Dr. John Snow used descriptive data and spatial mapping to trace the source to the Broad Street pump, leading to one of the first public health interventions, removing the pump handle. Summary and takeaways. Let's wrap up with the key points. Epidemiology studies disease patterns in populations to improve public health. It relies on models like the epidemiologic triangle and chain of infection. There are three levels of prevention: primary, secondary, and tertiary. Epidemiologists collect, analyze, and interpret data to guide decisions. The discipline is central to outbreak investigations, public health policy, and health promotion. Quick question: can you name all three elements of the epidemiologic triangle? Let us know in the comments and stay tuned for Chapter 2, the history of epidemiology.